Well, in addition to COVID-19 and the flu, the respiratory virus RSV is an increasing concern, especially for young children and older adults in the U.S. And we get more information this morning, including information on the coming vaccine from Fox medical team reporter Deena Centofanti in Detroit. Good morning.
Good morning, Brandon. You know, this is a frightening virus because, and in some cases, I should say it's frightening. In most cases, it's like the common cold. When an adult gets RSV, it's usually something you might not even realize you have. But when we talk about vulnerable populations getting it, and we're talking about very young babies, maybe babies born prematurely, heart, lung issues, compromised immune systems, or people on the other end of the age spectrum, older people with those issues, it gets a little scary. And with the babies, I just visited a hospital last week where they were just overloaded with RSV in their peds unit. Beds were full because the babies struggle to breathe. So that's why this is such a scary virus, and we're seeing a lot of it across the country, some of it higher in different pockets of the country. So this news about a vaccine is very interesting and encouraging because it seems like one of those viruses that when it gets out of control, like it is this year, it's a real problem. So right now, there's been a clinical trial. There's basically 4 vaccines that are getting a look or getting tested, nearing review by the FDA. And actually, a whole lot more are in the testing phases. So their officials are hoping by next fall there will be an RSV vaccine. We'll add another vaccine to our list of the shots. But in one recent clinical trial, one of the vaccines being tested was 75% effective in preventing this virus.
Right.
So we don't know if this is something that would be given to or recommended for just at-risk populations. That's all yet to be determined.
Well, and everybody recalls a couple of years ago, they had all these measures in place to control COVID. A lot of those are gone. People are getting out and about. Is that one of the things maybe fueling this uptick?
That's exactly what I talked to a doctor and a nurse practitioner, and they said it's what they call the immunity gap. Because remember, especially with little kids who maybe didn't go to daycare for a couple of years, didn't go to preschool, didn't go to kindergarten, those are all exposures. When those kids are in those classroom settings, they're getting exposed to all these viruses and they're building their immune system. And so you take a couple of years of that away from a child, and you got an immune system that wasn't working to fight RSV, wasn't working to fight anything. And so now when you get exposed to all these viruses, it's going to be challenging.
Right. So to the parents out there, what can you tell them about what to watch for? What are the symptoms?
The biggest risk is if your child is not able to breathe, and what you look for is a chest it's really caving in and out, or skin turning color. That's an emergency situation. That's the biggest concern with RSV because it gets down into the lungs and there's so much mucus. So if you go to the doctor with RSV or if you go to the hospital, they're going to try and teach you, parents at home, how to get that mucus out, how to make sure that your baby can breathe. And if they're not eating, that's another sign. I was told by someone who's treating a lot of RSV right now that it peaks around day 4 or 5. That's when it gets its worst, and then things start to get better. So it's a scary thing. Usually everybody is okay with it as long as you treat the symptoms. And they talk about using saline to flush out some of that mucus. Right now there's no medical treatment for RSV. It's just really treating those symptoms and making sure those little tiny air passageways in babies, they can get blocked pretty quick.
Right, and now we know what to look for. All right, Fox medical team reporter Deena Centofanti, we appreciate your time this morning. Thanks.
Thanks.